I'm Robin Castleman, and I'm here today with Dr. Walden from Bedickle Dental Care, and we're going to field some of the questions you guys have called in with. You ready?
Yes, ma'am.
All right. Welcome to our new set.
Thank you. I like it.
Thank you. All right. So our first caller says, why is it so important to get gum disease treated?
Great question. You know, they say high blood pressure is the silent killer. Well, gum disease is the silent destroyer of your teeth and your gums. And so it starts out with just inflammation and a little bit of infection in the gums, and you're not aware of it unless they kind of may bleed a little bit or they're kind of sore. But then as it advances, if it's not treated, then it gets into the bone, which supports the teeth. And supporting the teeth, then advanced gum disease, the teeth start to get loose, the gums recede, you know, it's unsightly, it can lead to, you know, bad breath, odors in the mouth. Many times we'll have a spouse say, can you check out my spouse, his breath is terrible, or her breath is terrible, and it's a lot of times it's from the gum disease. So it definitely needs to be treated, but it's like the blood pressure, you're not aware of it until it gets advanced.
So that when we come and do those yearly checkups, right, or bi-yearly checkups, that's when you can check for that.
That's when you check up. You know, the hygienist should be using a probe and going around the gums and marking how much space is there. Mm-hmm. And when you have like a 4, 5, 6, that means the gums the pocket is getting deep. So yeah, the gums need to be checked, and then if it's advanced, you definitely need to treat it.
Gotcha. Okay. Well, our next person says, I'm considering getting dentures, but I'm concerned about them being comfortable. Has the technology improved with comfort?
Well, the first thing I'd like to say is no dentures are comfortable. If you cannot have a denture, please don't. You know, sometimes people think that, you know, I'm going to get dentures and all my dental troubles are over. Well, sometimes they're just beginning, but in a different way. Now, there are advances as far as the digital dentures, where you take a scan and sometimes you can get a better fit. So, you know, the denture may fit a little better, but that doesn't necessarily mean it's going to be comfortable. You know, we're 3D printing dentures now. That can give a little bit better fit, but, you know, still, especially a lower denture, the dentures are going to move on you. And because we have a tongue, when the tongue moves, when we chew, eat, talk, then that lower denture is going to move. Now, what can you do about that? You know, you could have an implants put in to retain the dentures, to keep them from moving. But so yeah, there are advances all the time in dentistry, and we're trying to stay on top of it. But if you can keep from having a denture, please do not get one. But if you have to, yeah, the advances are there, and implants will definitely make it better.
Gotcha. Okay. Quick question. This person says, my front teeth are crooked, and I'm considering veneers to improve my smile, but are there other options?
There are other options. I mean, nobody wants to have crooked teeth if they don't have to. So, you know, look into the braces, Invisalign, other retainers type that, and that way you don't have to actually touch the tooth and prepare it. So sometimes no dentistry is the best dentistry at all.
Perfect. Thank you, Dr. Walden.
Yep.
You guys know your stuff, and we appreciate you taking care of us.
Thank you.
If you would like to revisit this segment of Health Experts, log on to WPSDLocal6.com and click Health Experts. Up next, a representative from Audiology and Hearing Center is going to be here with us, and they're going to talk to us about hearing loss. That's after this on Local 6 Midday.
Harris Real Estate and Auction will conduct